Monday morning here. It is dark and wet outside. We're still getting spotty reports about maybe some power issues, and we're following up with the Guam Power Authority on that. But we have right now in the KUM News Zoom room the chairman of the Physicians Advisory Group, our good friend Dr. Hoa Nguyen. He is joining Chris and Bree with an update on what's going on with vaccinations. Good morning, everybody, and good morning, Doc.
Good morning, guys. Good morning. It's
Good morning.
a lot of rain this morning, but it's still nice.
Well, it's good to be alive, first of all. Doc, I know that you would reach out to me over the weekend because of there was a national story here. Baton Rouge Children's Hospital, this is out of Louisiana, reaches capacity braces for surge in COVID cases ahead of school year.
And this is actually something that you guys were scheduled to discuss during your meeting last week, Thursday, with the Physicians Advisory Group regarding school opening and the need for students to get vaccinated that are eligible and
Yes,
their parents.
I tell you, things change a lot with the Delta variants. There's quite a few more breakthrough infection on the fully vaccinated people. And the breakthrough on the fully vaccinated people, they're not that sick. They have very mild symptoms that we can see so far. But the dangerous part is that the viral load is so high with the Delta variants that it's transmissible from the fully vaccinated person to the next person. So that's where the dangerous part is. And, as you can see anywhere in the news that the rate of infection in children who end up in the hospital is getting much higher than the previous strain. So we really have to kind of think ahead of the curve here and get the children vaccinated. From 12 to 17. That's a priority at this point, since the school going to start face to face pretty soon, the next 2 to 3 weeks or so. Right now, the percentage of children in Guam from 12 to 17 that fully vaccinated is in the 30%. About 34% or so. So we really need those children, especially the parents that are fully vaccinated. You need to take times out of your schedule and get your children vaccinated to protect them before the school start. It starts in 2-3 weeks, you will not get fully vaccinated, but at least, when you get the first shot in, you get about 80% protection from the COVID. So I would highly encourage parents that are fully vaccinated to, if they have children 12 to 17, to come out and get their immunization right away. One thing people have to know that in Guam, pediatric and adult is different. When you have an adult person that get admitted to the intensive care unit, you have the physician like Dr. Agan that's specially trained for that to take care of you. But when you have children in the intensive care unit, I don't think we have a board certified intensive care pediatrician that can take care of your children in the ICU. So you don't want to get there. All the pediatricians would try their best to take care of your children in the hospital. But again, they're not trained to be in the ICU. So you do not want your children to end up in there by any chance if they get COVID and wait for that moment. So I really highly encourage people to get their children vaccinated as soon as possible. It's kind of tricky in the part that the Pfizer vaccine, that's only one approved for children. There's 6 doses per vial. So if U or G are closed and the children go to the clinic to get vaccinated, and we don't have enough children there, when you open a vial, you only 6 hours before it expire. It's going to be a challenge in logistics-wise to try to not waste so much vaccine. So we're going to talk about, there's a special clinic for children to come that we can they can get there without us wasting the vaccine because it's expired. So that's something we had to really talk in the PAC in public health to try to get a clinic together, especially for the children only. But we had to push this issue very, very fast. The other one that we really want to talk, and I think it might happen, is that we're going to mandate the vaccine on GDOE staff, just because, remember, they work with children less than 12 years old, and those children don't have a choice to get vaccinated. So as an adult, we have the responsibility to protect our children, especially in school. So that way, we will not give them the infection by chance. So, it's a lot of ways, and you always have an exception to vaccination. But if you don't want to, I think we're going to push this like anywhere in the state right now. If you don't want to get vaccinated, then you're going to be tested once a week. But we're going to push for that mandated for GDOE.
Why just GDOE and not private schools included?
I think the private school, the private part is pretty easy. Just like for AMC and GRMC, we mandate all the employees to be vaccinated. So we're 100%. But so the private, there's not so much legality to it. Private can do anything they want. But the government a little bit more tricky. But I think that with the President Biden and the federal government try to push a mandate on their side, it's easier for the government to follow. I think that it's nice if all the frontliner get mandated, because that's we serve the people, and we gotta protect the people that we serve.
Mm-hmm. Yeah, with GDOE, I think the last time we had Mr. Fernandez on, he said that the vaccination rate amongst staff was like at 80%. And then months ago, there was that discussion about mandating vaccine for students, eligible students, returning to face-to-face. Do you foresee that sort of discussion kind of reigniting? And
mandating the children will be a little bit harder to implement because remember, 12 and under, they cannot get the vaccine yet. It's not approved yet. But it's easier to mandate the staff. Just like every year, the staff had to come in to get the TB clearance. That's mandated. You cannot go to work if you don't have your TB clearance. So it's easy to protect the children by mandate on the adult on the vaccination. So,
but isn't the TB vaccination also required of students?
Yes, they do.
Mm-hmm.
Most of the immunization are required to students. Not everything. Certain infection are easily transmissible from one person to the next, certain person, and certain infection are not. So not all of them are mandated on children. But again, children lung capacity and the anatomy is different than adult. So the adult lung capacity is large enough to transmit the virus a lot easier than children. Because the lung capacity is not as large as the adult population. So the rate of infection from the children and adult are much less than adult to children.
Mm-hmm. Well, I think that's interesting, and that you guys are going to have discussions about having this vaccination clinic for just students. Because I know that, like with my situation, I tried to get a physical examination for my son at his school because it's required. He has to have his medical records. He has to have that physical done before he can go to school. But everything is booked all the way till September, so I can't even get an appointment in. So
yes, you're correct. At the end of summer, it's very hard that all the children need the physical, and as most parents, we kind of wait till the last minute. So 2-3 weeks, and everyone try to come in, and all the clinics don't have the space for everyone to come in. But again, for us, we at this point with the Delta variant is so rampant in the state that we need to create something, a place where the only children can go, and especially from 12 to 15, or 12 to 17, and get the vaccine before the school start. Again, Pete, intensive care physician, we do not have one that's fully board certified. So that's my worry, is that if you have a Pete end up in the ICU, that our pediatrician have to go way beyond their training to take care of the children if they end up in the intensive care unit, and that's something that we do not like to see. Again, if the parents are fully vaccinated and the children are not vaccinated, there's a chance that if the parents are sick with the Delta variant, that they can carry back home to their children. That's the worry part that we have on our children.
Right. Yeah, and if eligible children aren't vaccinated, the likelihood that their parents aren't vaccinated, you'd think that that's.
Yeah, right now our adult rate is 80+% already. So I know that those parents that have children, because the work schedule, whatever, they really need to take the time out and take the children that are eligible for the vaccine to come in to get the vaccine, their immunization, like as soon as possible. So please take your time and take your children in and get the vaccine. I gotta check, but I think most of the large clinics should carry the Pfizer already. FHP, SDA, AMC, they should have the Pfizer on hand, and also some of the pharmacy also have Pfizer on hand. And so there's public health north and south. So quite a few locations there, but take your time in, and I'm gonna ask the clinic to try as much as possible to be very flexible to provide the Pfizer vaccine for the children, but not wasting a lot. So we have to really come up with some type of schedule to get the kids in to get their immunization.
So, this is gonna just one. So you really think that these parents that are, you said, vaccinated because it's 80%, they just really it's because they don't have the time to take their child in, or to get vaccinated, or they just don't want their child to get vaccinated?
We have quite a few people that we were vaccinated in the clinic that the parents know if we push it, because I tell you the work schedule or whatever, they just need to take the time, and time is something that we often hear a whole lot, that we need to make the time. That's the answer. Some of the parents that we were talking to is that they need to take the time. Yeah. I know that we are all busy, but with the Delta variants coming down everywhere, it's really, we need to do that a whole lot, and do not wait. And that's the thing. Just like you say before, when we get 80% plus, people think that everything is over, but it's not truly over yet. With this Delta variant coming on, is opening a new chapter for us.
Doc, I think a lot of people, as well, from what I heard, is that they're not getting the kids vaccinated because during the pandemic, we were told by many of the doctors that kids did okay against COVID. And so now that's changing because of the Delta variant. Yes.
Chris, absolutely right. This COVID virus here is really interesting, and they change, and we really try to educate people on certain change or what we have today. To a few months from now, if the virus mutate again, we're going to send out another different message. So you just have to follow the change, and we cannot think that the first strain don't affect children very much, but the Delta does affect children. So we just have to pass this message, and as much as possible, so the parents and the people know that, hey, it's different now. Just like I said, the the previous strain, if you're fully vaccinated, the chance that you transmit the virus to another person is low. But this Delta variant, because it's so much higher in viral load, yeah, it can be transmissible from one person to the next, even if you're fully vaccinated. And that's why I ask people that if you're fully vaccinated and you have some upper respiratory tract infection like congestion, don't ignore it. Come in and get tested because you can give to the next person.
Doc, we had a comment here. Very general question. Is the Delta variant in our community?
You know, I'm very sure, Chris, that is in our community already. CDC take about 3 to 4 weeks or longer to send us back any type of specimen the public health sent to them for confirmation. But with the breakthrough infection that we see a few so far, I'm pretty sure that it's there already.
Yeah,
So,
in June there was a press release on the variants with their latest sequencing that the CDC did for Guam, and it did say that there was one case. That was in June, though.
Yeah, but then when we had
Yes.
Chima on, he said that it was contained, or it was his answer was kind of waffly.
Yeah.
Yeah, but remember they have we don't have quarantine anymore. So people come in with just a PCR testing. If fully vaccinated, they come in with no test. So you know, a Delta variant can come in very easy to do that. And you know, I mean, there's nothing wrong with have no quarantine, right? Because 80% of people plus are fully vaccinated already, and you don't see that many people in the hospital except, you know, the unvaccinated population. So you had to open the island up, you know, with 80% plus because the hospitalization is low. But again, when the Delta variant is coming in, it might change the equation a little bit. So we're going to monitor the situation, you know, very closely, especially on the fully vaccinated and how many of those fully vaccinated end up in the hospital. And you know, like I say, as we get more data, we'll make different decisions if we see the hospitalization are going up, especially on the fully vaccinated people. But I don't think it does because across the United States, 96-97% of people in the intensive care unit are unvaccinated population.
And also, there's just no way to test, Doc, right? If somebody has the Delta variant, you need to have that genomic sequencing, and that's like after the fact, right?
Yes, after the fact, and the after fact about several weeks later.
Mm-hmm.
And you know, not every specimen that you send to CDC have the enough viral load for them to do the sequencing. So you have to pick one that when you swap, there enough viral load there that they can do the sequencing. So yes, we kind of behind on that, and you know, on the all the specimens we send to CDC, and it's not us. It's just that the whole system is slow.
Yeah.
But the message I wanted to come across today is please get your children vaccinated, and I will push hard with the PAC, the governor, and public health to try to somehow come up with a way that make it easier for our children to go in and get vaccinated. No, maybe one location or two locations that's all they do is just children. So make sure that we increase the number at least to 50-60% before the school start, at least the first shot anyway.
By a day. Maybe in your next meeting with the governor, you can bring up the RISE Act, All Rise.
That's out of my name.
You know, Doc,
I'm not a miracle worker.
just to follow up on what you were talking about, no quarantine. Are you aware? Are we still? Is the quarantine facility and the isolation facility still stood up by the government? We're still paying for that.
For my understanding, yeah, we still have the isolation facility and the quarantine. They're supposed to combine the two together in one hotel, but I'm not sure where that process is. at this point. But you know, we don't have that much people in quarantine, but we do always gonna need a place for people to isolate. Just because some people don't have enough adequate space at their house to isolate and protect themselves and protect the family. So that's something that we're always going to have an isolation hotel.
Okay.
A facility.
Right. Any other
Okay.
final words for parents out there?
I just tell you, Law or Murphy, anything can go wrong. It can go wrong. So, please get your children vaccinated. Don't wait till the last minute. That's your children. So please get them vaccinated. Take your time. Come in or make an appointment at the clinic and get your children vaccinated at least one dose before the school start.
Right on.
Thanks, Doc.
Thank you, Doc.
Thank you, guys.
Okay, be safe.
Bye-bye.
There you go.
Stay safe.
Hi, day. Sometimes it's confusing, right? Because we just flipped open everything last week. And you get that message, and then here come the doctor saying, "Oh, wait a minute. Guys, settle down." So just be safe. 7:40. We got to take a quick break, and we're coming back with the Empanada King, the mayor of PD, Mayor Jesse Alec. Next, the show brought to you by Cabo Enterprises, IT&E, Jack in the Box, and Pacific Points.